Good afternoon, everyone. Welcome to this afternoon's Peoria County Health Department briefing. I'd like to start today by acknowledging that today is the National Prayer Day, and so I'm not going to actually say a prayer, but I am going to offer a moment of silence for anybody that would like to participate in their own way to observe National Prayer Day in our country. Thank you. We have a couple of very important speakers today, which we're going to get right to. The first will be the Medical Director of the Health Department and the Chief Medical Officer for Heartland Health Services, Dr. Gregg.
Thank you, Mayor. I'll present today's data. First, the number of confirmed cases is now 199 total in 3 counties, 130 in Peoria, 54 in Tazewell County, and 15 in Woodford County. There have been 5 deaths so far in Peoria, 3 in Tazewell County, and 1 in Woodford, for 9 total. 61% of the tri-county cases are recovered. 26% of the tri-county cases are at home isolating, and 9% of tri-county cases are hospitalized. For the hospital data, ICU beds in use, 15. Persons under investigation in ICU, 4. Confirmed COVID cases in ICUs, now 11. Non-ICU beds in use for COVID are 37. There have been no deaths in the last 24 hours. Of the 130 cases in Peoria County, 75 have recovered, 38 are in home isolation, 12 hospitalized, and 5 deaths. The gender makeup, 40.8% are male and 59.8% are female. In Woodford County, the confirmed cases are 15, with 11 recovered, 3 in home isolation, and 1 death. We don't have the recovered data for Tazewell County at this time. Today's testing at our sites, we did 12 tests at Carver and 89 at East Bluff. I have a couple announcements. One is tomorrow we wrap up the testing at all of the 5 shelter sites that the mobile van goes to. We've offered that to all residents and staff, and those are the Dream Center, Esther House, Southside Mission, Peoria Rescue Ministries, and Salvation Army. Saturday, the residents of the 4 Points Recovery Center will be tested also. And then we've decided to open up testing. As you know, in the past, it's been people with symptoms that were supposed to be tested. We've decided to open up testing to all adults, regardless of whether they have symptoms or not. When you look at Governor Pritzker's stages of development of opening up the state, that's one of the stages that has to be achieved to, I think, get to level 3, and that is opening up testing to all individuals. So we will open that up to adults starting tomorrow, regardless of symptoms. So thanks. It's my pleasure to introduce Dr. Ted Bender from UnityPlace.
Thank you, Dr. Stoner. Good afternoon. I'm Dr. Bender. I'm here to talk today about the disease of addiction through the current pandemic. This has brought challenges, unique challenges to all of us, but especially to people who are struggling with substance use disorders and alcohol use disorders. The National Center for Drug Abuse Statistics showed in 2018 that between 20 to 30 million people in the United States suffer from a current alcohol use disorder or substance use disorder. About 14 to 15 million of those primary diagnosis is alcohol use disorder. We have seen statistics showing sharp increases in alcohol sales in the United States, but there's also mixed evidence showing that while some people are drinking more, others are drinking less. Regardless, the disease of addiction is brutal enough even in the face of normal times. But in times of increased isolation, addiction can really feed off of that. Addiction is a disease that thrives in isolation. And one of the treatments for addiction is social connectedness. And during these times, it's incredibly difficult for people suffering from addiction to be socially connected for obvious reasons. So one thing that I wanted to talk a little bit about today is what we can do to maintain sobriety during the course of this pandemic. And I reached out to old colleagues and friends of mine and people I know that are in recovery and kind of just asked them what they thought and what they were doing to maintain their sobriety during these tough times. So I want to share some of that with you today. If you're at home, if you're watching this, if you're struggling with your sobriety or if you've relapsed, there are some things you can do to take action now. First of all, do your best to ensure that your living situation is safe and healthy. If there are triggers in your environment, try to remove those triggers. Also, keep the dialogue open with your support system. This is critically important. If you're in AA or NA or in some form of support group for recovery, reach out to the people that you're connected with, your sober support system. If you have a sponsor, reach out to your sponsor. Stay connected daily in order to really continue to maintain and work on your recovery even during this tough time. Let's face it, it's easy to just say, we're all dealing with this problem. It could be a good excuse to continue using or relapsing, and we can justify further use in our mind quite easily right now. But it's critically important that we continue to fight even in the face of this pandemic, because the risk of exacerbating mental health symptoms and accidental overdose are high right now. To make it even worse, people who are suffering from life-threatening conditions such as potential overdose from opiates are deciding not to go to the hospital for fear of contamination from coronavirus. So I want to remind everybody, especially in this area here, that our hospitals are safe. Our hospitals are still functioning. If you are having emergency symptoms and you need help, you need to go to the emergency room, you can go to the emergency room. We've taken every precaution and you will be safe. Do not stay at home with a life-threatening condition for fear of coronavirus when you absolutely need emergency services. So continue to use support, continue to reach out to sponsors, reach out to friends and family, as many of us have been doing during this time. But there's also very concrete things you can do if you don't have some of those, or even if you do have some of those support systems. There are many Alcoholics Anonymous and Narcotics Anonymous support groups that are now being offered virtually online. I did a search just recently at aapeoria.org/meetings and a couple days ago, and there were at least 11 meetings in that one day. So there is a lot of resources that have gone up, and a lot of resources for people who are struggling right now to seek support virtually through the internet. You can also go to na.org, Narcotics Anonymous, and search Peoria, and you should find a lot of meetings there too. Also, the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, has a tremendous amount of resources on their website, which is www.samhsa.gov, and that's SAMHSA. Once again, www.samhsa.gov, and you can browse their list of resources as well. When I'm speaking to some of my former colleagues and friends who are in recovery themselves, and I asked them what they were doing, a lot of them told me that they were immersing themselves in recovery literature. The Big Book is a very common one, Alcoholics Anonymous. Other friends told me they were engaging in a lot of prayer and meditation. And one quote that a friend of mine said to me that I think that made a lot of sense here is when you're fighting the disease of addiction, at first, you may be very motivated to stay sober. You're doing all the right things. But eventually, motivation has its own half-life and will start to wear out. And when motivation runs dry, the only thing left is consistency. So he mentioned that once you start to feel less motivated, the consistency part is how you're going to maintain your sobriety long term. So keep doing the things you were doing to stay sober, if not slightly altered. Practicing mindfulness, focusing on the present, also reaching out to providers if additional help is needed. And that's what I'll wrap with today. If you feel like you're struggling and you can't maintain your sobriety, or if you have relapsed recently and you're engaging in dangerous drug use behavior, there is help available. UnityPoint Health, UnityPlace is one of the few treatment providers in the area that have maintained relatively 100% occupancy and efficiency throughout this. We've closed very few lines of the business. We have inpatient, residential, outpatient services available. We have virtual services, both telephone-based and video conferencing available with individual therapy and group therapy. And you can still get the care and the treatment that you need. If you need inpatient help for drug addiction or substance use or alcohol use disorder, we have that available. If you need outpatient services therapy, we have that available too. You can call our UnityPlace Access Center at 1-888-311-0321 or visit us at unityplace.org. I'll be happy to take any questions if we have any.
Do you have any statistics on the amount of people who have, or I guess how you would say, have turned to alcohol or narcotics during this time? I know you said it's somewhat hard to measure, but are there any numbers that point to that middle? You said it's somewhat of an increase and somewhat not.
You're right. It's very difficult to gather that kind of data that quickly. I mean, for example, we're still waiting on the CDC data for overdose deaths in the United States for 2019, which usually comes out in the summer of the next year. So I think the answer to your question basically is, newly formed addictions. I think we'll have some data on that, but it might be quite some time before we see that. One thing that we are seeing nationwide, which has been on my radar and is particularly troubling, is we are seeing once again increases in overdose deaths in the United States in certain pockets of the country, and we really hope to curb that trend, especially here in this area where we have seen a few increases as well. Other questions? Thank you.
Sure.
So with the 5 mobile vans that have been going for a while, why was the decision made to cease operating those? Was it just they've kind of run their course, or low usage, or what was the reason behind that decision?
Oh, we're not ceasing operation of the mobile van at all.
Oh, you're not?
No, it's just that we're going to have completed testing at all the shelters that we go to with the mobile van by the end of the week. But the mobile van will continue to go. But what we have found is that a couple of the centers, because of the COVID-19 crisis, have stopped accepting new residents. And so there aren't any new patients to see when we go there. And so particularly Southside Mission and Esther House, we're cutting back the number of times we go a month to those 2 locations. But we're still going to the Dream Center, Salvation Army, and Peoria Rescue Ministries weekly. Okay, so no, we are not shutting down
that makes a lot
okay,
more sense.
and it's one van that does all 5.
Yeah.
So okay.
So how many tests have been conducted so far using the van?
We started just this week testing at the sites. We had sent the staff largely to go to our individual collection sites. Because they can drive their own car and go in and get tested through the drive-through part. And so when the van went to Dream Center, which was the first thing on Monday, we did 24 there. And then Esther House and Southside Mission, people had been tested completely at Southside Mission last week, so we didn't do any there, but we've done all the residents and staff. And then Peoria Rescue Ministries, I'm not sure how many we did, but it's somewhere I think around 12 or something like that today. And then we do Salvation Army tomorrow and the Recovery Center on Saturday.
Gotcha. And then the 4 points mentioned there's going to be testing there as well. Now, the last we heard a couple weeks ago, there were 6 people there.
Okay, it's down to 4 right now, 3 men and one woman.
Okay,
Mhm.
so those 4 people will receive testing
On Saturday morning.
Saturday
Yes.
morning. Okay. And then can you talk a little bit about the decision to open up testing to everybody, basically all adults. And I mean, what's the reason behind that? You talked a little bit about just the need to widen the criteria, but I mean, we've seen kind of the testing at these sites decline in recent days. So do we have enough testing to do that now, essentially?
Well, it's hard to know exactly what the demand is going to be, but it looks like we do have enough material to do the testing right now. It's something we've wanted to do all the time since testing, since this whole crisis began, is test as many people as possible. And now we actually have the ability to do that. So I think we have probably a couple thousand extra tests right now.
Has
And
there been any thought that taking some of those over to one of the Beacon locations by chance?
Our CEO, Sharon, is going to be here tomorrow to announce our kind of change in plans, but in essence, yes, we will be going to Beacon. Okay, and she'll give the details on that tomorrow.
Forgive me if I missed this, but is anything changing in terms of your capability to process more tests? I'm assuming more adults will be showing up because they know, okay, now I can come.
Mm-hmm.
Will you have more attendant healthcare workers, volunteers, et cetera, to help keep this process going smoothly?
Well, we have enough people at the collection sites now to handle about 150 people a day at each site. That's kind of, I think, where we would kind of max out the number of people that we could handle at a given site on any given day. So we'll continue to do that, and we have the staff to do that.
I'm not sure if you're familiar with the situation in Rockford. There were some tests that were lost, approximately at 2,100. So can you explain? They have not been clear about whether it was the specimens, whether it was the technology or data. What is being done to ensure that we don't have a situation like that?
We double check everything against the data that we get from the testing lab. We have a copy of everyone's request form. We compare the requests to the portal information that we get on all the tests that have been run and make certain that we're not missing anybody. So yeah, there's a couple double checks on that to make certain that we're not losing any tests or ignoring anyone. We're trying to answer everyone's request as quickly as we can. The labs aren't always out in exactly the same order that they're received. And so that's where we first started out at 48 hours, saying we would try and have everybody have the results in 48. We kind of had to extend that to 72 hours. But we try to get everyone the results as quickly as we receive them. We ask that people that have phones that are capable of receiving texts to receive them that way, and if they say yes, then their requisition form is marked that way, and then they receive a text as soon as we get those back. I personally review all the positives and look and see who their physician is and where they receive their medical care, and if they're a Heartland patient, we notify their primary care physician, and if they're not Heartland, the health department is already going to follow up on them anyway, and as they do follow up on all of our patients with the contact tracing. So.
Why would a healthy person want to be tested?
It's a great question, and we think that a lot of healthy people will want to be tested because they're worried about it. I think that's really why they may have some minor symptom. They might have something that might be an allergy or something else. They might be totally healthy and still want to be tested just to ease their mind. We're not encouraging people who have absolutely no symptoms or are young and healthy and everything to necessarily come in and be tested, but we're open to anyone who wants to be tested right now.
At one time, Monica was telling us that you had to have a certain level of virus in you for it to be detected in these tests. Are the tests better now that they would, detect it in people?
No, I don't think so. I think they're the same. We do the nasopharyngeal swab, which is a swab that people say is like tickling their brain, and we do that and submit that, and then they chemically multiply the RNA in the swab, and then they can analyze it. So no, I think the technique has stayed the same since we started. Okay. Anything else?
Can or will the
Okay.
130 people that tested positive be retested after 14 days? See if they're-
Great question. If someone has recovered, they probably don't need to be retested. We think that we're going to retest anyone at the shelters over again because they live in congregate living situations, that they'll be tested every 14 days. But someone that has it and they've been tested positive and they've totally recovered, they don't necessarily need a test. Okay. If their job required that they be tested to return to work or something like that, then they could be retested. Good. Anything else? Okay. Well, thank you.